Hello, everyone. Well, a lot of people are living in pain, taking all kind of painkillers and medications. Well, we are not saying that don't take the medications, but what we are saying is, what are the lifestyle changes that you can do to help relieve the pain? And that's why we're talking with Anjanaa. Anjanaa is a physiotherapist as well as a functional medicine practitioner joining me. Thank you, Anjanaa, for joining me. All right. So in your practice, let's just talk a little bit about most of the patients that you see, the clients that you see, if they have chronic pain, are they on some kind of a medication or what are they doing?
Many patients who come to me have had pain for more than 3 months, and they are on a present opioid or a prescription opioid use, because when their pain varies or when their pain is more than 80% of their capacity, they are definitely advised to take opioids, which I subscribe to. But my job as a physical therapist with them is to bring the pain down from 8 to 3 so that it becomes more manageable and slowly help them to taper the medication. So that's what I do. From 8 to 3, I work as a physical therapist with them. And from 3 to 0, I work as a functional medicine practitioner with them, trying to understand the imbalances and trying to get rid of the chronic pain. 8 to 3 is definitely assessing their movements, imbalances, lifestyle. What are the small changes they can do in everyday life? And how can they bring in some kind of hygiene in their life so that they can sustain being in minimal or manageable pain?
Okay. So let's just understand a little bit more deeper as to what kind of process or the protocol that you're using from 8 to 3. You said it's mainly focused on the movement part. If you want to elaborate a little bit on the movement part, and then from 3 to 0, what kind of lifestyle modifications are you generally, this is not a medical advice, but on a general level, what are you prescribing?
So, from 8 to 3, when you are in severe pain, the first thing it is to understand what is triggering your pain. So, what are the triggers to your pain? So, how do you move during the day? How do you get up? How do you sit? What do you do? And those are the factors I focus on. And most of my patients I see, if they are even very active, they pack all the movement in that 1 or 1.5 hours of gymming. And after that, they come back and they are mostly sedentary because of work from home and COVID protocols, restrictions, they are in the house. The remaining ones are the ones who are not active at all. So they get up in the morning, they don't have a proper schedule. So they get up in the morning maybe 15 minutes before they have to log in. So they maybe do not have breakfast, they jump in and sit in front of the system, and they are there in front of the system for prolonged periods of time. So one are the not so mobile, the ones are the mobile ones, but who pack their movement in that 1 hour. So, my advice to anybody who is looking to be pain free and be injury free is that you move at regular intervals. So, they are not movements, they are micro movements. So, make sure that you choose to do 1 or 2 things, maybe 2 to 5 times every 2 to 3 hours. So, that way your body gets a constant feedback that it needs to move, and that's how our brain is designed. Our brain tells us to move, and movement is a biological need for us, which in modern times we can easily offload, because all our modern amenities do not, they help us to offload movement and do not allow us to move much. So it would be nice that you could put movement, a small movement break in your schedule 3 to 5 times in a day, and that will be great. So most of my patients, I ask them to have a variety of movement again, because we move in repetitive ways. Our areas, the places where we stay are small, and the things we do in the gym are also many times repetitive. So I ask them to maybe once focus on the breath. The schedule is made in such a way that they'll have movement variety throughout the day. So my simple advice would be to move more during the day and to move more of you during the day. So that helps you to generate those good hormones, what we now talk serotonin, dopamine, oxytocin. These hormones are naturally anti-inflammatory and thereby naturally brings the pain down and brings the state of alert down. And once that happens, naturally your dependence on medication is less, because if you see over a period of a week that your pain is not flaring up and you're moving yourself a lot more, then it is a natural driver for you also to stop the opioid, or rather taper the opioid dependence. So this is one major thing I do. The next major thing I ask them to do, if they are okay, is to use as minimal furniture as possible. So instead of being stuck in a chair where your hip and knee is always fixed like a cage, so mostly furniture now is like a cage. So you try and sit for maybe 5 minutes, 2 minutes on the floor. If it is possible for you, try do long sitting, vary your position, put cushions, put pillows, and then just be on the floor because that gives you a lot more movement and freedom. If a floor is not possible for you, choose a low couch like on what I'm sitting right now. Choose a low couch so that when you get up, you will be forced to lift yourself up, and thereby you will be using your knees and thighs. That is only when, after assessment, they are okay to do such low movements. But I basically tell them as to what level they can do, and in that level, what are the things they can do. Then the third one, and I'm from India, so the third one I basically advise patients to do is to eat small quantities at regular intervals. So basically eat in moderation, and thereby you keep the hunger drive up. Eat small quantities throughout the day so that the carbohydrate intake and the macro and micronutrients are balanced throughout the day. That also definitely helps in healing. The fourth and the last point, which I think is the most important one, is to maintain a sleep hygiene. I ask them to go to bed at the same time, wake up at the same time, and thereby regenerative and repair processes happen. So these are the four things I really focus on to bring them from 8 to 3. And to bring them from 3 to 0 is I look into what physiological and biochemical processes are going through testing, through functional diagnostic medicine testing. And then based on that, I take it forward. But again, the dependence is not on any supplementation. I don't match a problem with the supplementation. Basically, I try to work on their lifestyle because that would be more easier to carry forward in their lives.
Okay, and what kind of lifestyle modifications are you recommending when from 3 to 0? Could you expand a little bit on that?
I focus a lot more on what they eat. So when we do functional diagnostic testing and we see what if they are sensitive to specifics, like for presently in my clinic I am seeing patients who are sensitive to gluten but have no celiac, but the gluten gives them musculoskeletal issues, for example joint pain, swelling, fatigue. So I basically allow them or ask them to eliminate gluten for some time and then slowly reintroduce it. Then the second, and some patients are allergic to dairy. They are not allergic per se medically, but they are sensitive to dairy. And that's when I ask them to eliminate and slowly reintroduce. So these are the food restrictions or food changes. So I focus on what is on their plate and what should go in. Again, the food which I prescribe to them are not supplements. They must be natural foods which must be grown locally, and you eat something which you have eaten throughout your childhood. So basically, because your gut microbiome is generally tuned or designed the way you were brought up, so do not change it so much. You stick to what you have eaten. Eat a variety of foods, have variety in your plate, and make sure you have any locally available probiotic. In India and southern India, from where I belong to, curd rice, mixing rice with curd is a very important ending of the meal. And I follow it now because at least once or twice in a week, because when you mix rice and when you mix curd, it balances the protein in the curd and protein in the rice, and thereby it is a lot more, it's a probiotic mixture which is in a more stable form and more utilizable form of the body. So like that, you go back to your native foods and eat. That will be the first thing. The second thing what I ask them to do is again move more, but here now move more mindfully. So add breath. So if you want to go down in a chair, on a low chair or a stool, I want you to breathe in, use the core, allow the core to come out, go down. So allow the diaphragm to go down. And once you go down, breathe out gently so that you allow the diaphragm to come. So you're basically allowing the ribs to move, you're allowing the core to move, you're basically bracing the entire torso, which gives you a good balance and posture when you are doing this. And over a period of time, these habits, they become automatic patterns in you. So thereby, even when you are doing these movements, you don't injure yourself much. That is the second thing. So here is moving mindfully. The third is, again, I focus a lot on sleep and sleep hygiene. Again, you need to now, if you were sleeping at say 12 before, and from 1 you have come to 12, I would ask them to shave off 1 more hour and go back to 11, so that you at least get the restful sleep, the biological restful sleep, which is designed from 10:30 to 3:30. You at least get that restful sleep. So that is the third thing. Then again, I put after all this, if they still need any nutraceutical supplementation, it is given for a small period of time. For example, if you have leaky gut and your leaky gut is causing musculoskeletal issues and not allowing your pain to come down fully, that's when I would work on the leaky gut for you. So the nutraceutical part comes last after all these factors have been set, and still if there is anything residual, usually it will be 1 to 0, and everybody wants to be at 0, right? Nobody wants to be with pain.
Those are great tips, Anjana. I think the way you explain the whole process, I think it should work, because it's a very systematic process, the way you explained it. You're starting someone from the movement part, and then you take them systematically with combining the diagnostic testing and then making sure the gut is right, the gut is at the optimal level. So these are great tips that you are bringing to all the people out there, who are suffering from pain. There is hope, and that's what Anjana is helping all of us to bring hope today. Anything else you'd like to wrap up with?
This is what three things I would like to say. So being pain-free, it's not difficult. And once you have pain, you feel many a times whether this pain will ever go away. Pain is again a state of your brain. It's not much of a state of your body. And pain is not directly proportional to how much injured you are, because all tissues, they heal in their own processes, and your body has a natural healing capacity. As practitioners and as patients, we have to understand that we are being facilitators, or we have to be facilitators to heal our bodies, and we have to use different methods, because there is no one size fit all here. So use different methods and work with your practitioner, talk to your practitioner, give them a comprehensive idea of what your lifestyle is all about, so that the practitioner can work with you and tell you what has to be done, and you can do that and be pain free. So living with pain is a statement I do not agree much, because you don't have to do it if you do the right things at the right time.
Thank you so much. These are great tips, holistic tips, again, advocating a holistic lifestyle that you can incorporate, and that's what we are doing, and more so now with all the Omicron and COVID that's happening, right? With that, thank you so much, Anjana, for being with us. To all of our viewers, thank you for supporting us all throughout. We are launching a lot of workshops, so stay tuned and we'll keep everyone informed. With that, have a great day, everyone. Thank you.
Thank you so much.
Bye-bye.